first came into Dr. A's office, I felt at home. I loved his staff, and that was key and foremost for me since I'd never done anything like this. I had no reference points whatsoever. I looked at the competition online, and I looked at the portfolio of each of them, but I think what really sold me on Dr. A was the staff and the double board certified. He took ownership of his work. He wanted me to have the best experience, but at the same time, he wanted to make sure that he was giving me what was safe and also what was going to be the best for me, customized for me, and I like that.
Kimberly was a very interesting patient because she's becoming more of the common patient now with the bariatric surgeries that are done. They've lost hundreds of pounds, a lot of loose skin, and they come in with a misconception sometimes, and she did too, that you could do everything at once, which is extremely dangerous. The wrong thing to do is to go to somebody who actually wants to do multiple procedures on them. These are not normal patients. They have large vessels, they bleed very quickly, they usually have secondary medical problems. Like I do get a lot of patients that come from other doctors or countries that have had all these commando operations, and they tell me their horror stories of how they barely made it out of the hospital, they broke open, they were weeping for 6 weeks, they lost their job because they didn't realize that doing 2 major operations at one time basically immobilizes the patient for up to 6 to 8 weeks, which basically means no one's going to hold your job for that long. I do encourage you to pay attention to those details because at the end of the day, you do want to find a facility that is used to doing bariatric patients safely and with excellent results. I like to make sure that the surgeries that are done, especially on the bariatric patients, the ones that have lost a lot of weight, are done very carefully, tactfully, and perfectly so that each patient gets a perfect result, which they deserve. They've lost all this weight. Now they need a good plastic surgeon to make them look how they feel inside.
You are a little nervous because you're going under, and it's not the most comfortable thing in the world. But when you have a staff that is not just business, but also very personable, they made me feel at home, they made me feel comfortable. My actual procedure went very well. I think the one thing that I really liked about my procedure after I got home is the follow-up care. I got a phone call that night. The care and the awareness that I was going through this from his staff made me feel like I was pertinent to them and not just a ticket item.
The first surgery I like to do on large weight loss patients definitely is the tummy tuck, which is what I did on her. I took her basically midsection and took all the extra skin and tightened as much as I could. Second surgery, about a month and a half later, 2 months when she was fully recovered from the tummy tuck, was a breast reduction with a lift, basically called a mastopexy with a reduction. Totally changed her personality from being shy, not wanting to show her body. So just with those few months of transforming her, her confidence, her self-esteem, her mind has grown, and she's becoming the woman that she always was, who was trapped in a large body.
I now, through surgery, have a more real contour without having to put anything on. I can go without a bra, and I'm almost 50, so that's awesome. It's not just beautiful inside, it now beams outside, and that's because I feel so good inside. It's not about what this is. It really is what this made me feel here, and now I exude it every day with everyone.